question is it safe to get your vaccine from two different pharmaceutical manufacturers?
I'm diabetic, which elevates me to Tier 1B. At the time I go for my vaccination, do I need to provide any proof of this medical history?
I would like to know if we still have to cover our face and take all the same precautions as before after we get the vaccine.
Can I still be a carrier after being vaccinated?
You sent us your coronavirus questions, and now our panel of experts has the answers to these questions and many more. From News Channel 3, the desert's news leader, this is Your Vaccine Questions Answered. Here's Peter Doubt.
Good evening, everybody. I'm Peter Doubt. This is a special edition of News Channel 3 at 6:30. Tonight, we have brought together some top local medical experts to answer your questions about the coronavirus vaccine and how it will be distributed. So let's start by introducing them. We have the Director of Public Health for Riverside County, Kim Sarawatawi, the Chief Medical Officer of Eisenhower Health, Dr. Alan Williamson, and the Director of Pharmacy Services for Desert Regional Medical Center, Tim Perlich. Thank you all for joining us. All right, we've received a lot of questions from viewers, and we want to get to as many of them as we can, so let's get started. Take a look.
Hi, my name is Mike. I'm 68 years old, and I live in La Quinta. I really have three questions. The first, when do you think and how soon do you think I'll get the vaccine? Second, how are they going to notify me? Will it be email, a phone call? And then third, what do you think is the most likely way they're going to distribute the vaccine? Will it be through pharmacies, through doctors' offices? Thanks for taking my question.
Thanks, Mike. We've received numerous questions similar to yours. So, Kim, what are the answers from the county?
Thank you, Mike, for that question. So, as many are aware, the state has put out phases, and that dictates who is eligible for vaccine at any given time. We are hoping that we will be moving to phase 1B next week, which will include some of our population, the general population, in older age groups. And so in terms of how we will be communicating that to people, it will be through press releases, our website at ruhealth.org. If you click on the COVID-19 vaccine icon, it'll take you to a list of who we are vaccinating at that particular point in time. It will also list different sites where you can get the vaccine. And so we will be distributing that information a multitude of different ways so that we can reach as many people as we possibly can.
And Kim, what is the most likely way people are going to receive the vaccine and where?
So vaccine is being distributed now to providers, and we as County Public Health are also working with our partners to set up what are called points of dispensing or a mass vaccination clinic. So people will be able to either go to one of our mass vaccination clinics or to providers that have vaccine. And so people should call their provider and see if they have vaccine yet, or go to our website and we will be listing providers that have vaccine available.
And if I could follow up with that, Kim, are you satisfied with how the vaccine is being distributed right now in the county? And are we on track compared to other counties?
Our biggest challenge right now is the availability of vaccine. So we have many more people that need to be vaccinated in all of our phases than we have vaccine available to us. We get an allocation every week from the state of California, and that allocation has to be distributed both to providers and to provide vaccine for our points of distribution or mass vaccination clinics. I would love to have more vaccine because I would like to vaccinate faster, but that truly is our rate limiting step at this point.
Okay. Moving on to the next question, take a look.
Hi, I'm Patty. I live in Indian Wells. My question tonight is, after we get the first shot and the second for the vaccine, how long is it effective? And also, are we still carriers? Are we still able to spread the virus? That's my question tonight.
Thanks, Patty, for your question. Dr. Williamson.
Thank you, Patty, for that question. As far as being a carrier, there's emerging evidence that it does appear that the vaccine greatly reduces the likelihood that you can pass along the virus to others. So it is one of the important reasons that we want to get people vaccinated as quickly as we possibly can. In terms of when we get immunity after the vaccination, both the Moderna vaccine and Pfizer vaccine show that 7 days after receiving the second shot, which occurs either 21 days after the first shot in Pfizer's case or 28 days after the first shot with Moderna vaccine, that 7 days later, both are at approximately 95% effective in terms of reducing your risk of infection.
All right, let's get to the next question.
Hi, I would like to know if we still have to cover our face and take all the same precautions as before after we get the vaccine. Thank you.
Thanks for that question. Tim?
Yeah, that's a great question. Because the majority of the population is still not yet vaccinated, the recommendation is that we still cover our face to help prevent exposure to others that aren't yet have an established immunity. So we will be continuing to do face covering, social distancing, and practicing good hand hygiene.
All right, this next question comes from Judy Selvey, who emailed us. My mom has never had any vaccines. She is 84. Can she safely get the COVID vaccine? Dr. Williamson.
Yeah, that's another great question. These vaccines that are coming out, the two that are already approved, both are remarkably safe. We've seen very, very few serious side effects from the vaccine. People do often get some soreness in their arm. They sometimes have fever, chills, headache, and so on. But in terms of actual serious complications from the vaccine, it's been remarkably safe. So I would strongly recommend all of our community to really seriously consider getting vaccinated as soon as they can, based on what phase they are in.
And along those lines, Dr. Williamson, what about people with compromised immune systems? We've received several questions from people with cancer, lupus, and other health conditions. Should they get the vaccine? And if so, do they get priority before the general public?
Yeah, as far as we can tell from the studies that have come out, and these are not groups, unfortunately, that have been really studied in depth, but it does appear that they still do mount an appropriate immune response to the vaccine, regardless of their current immune status. HIV patients, for example, seem to respond quite well to the vaccine in terms of mounting a response. So again, I think there's no reason for people to be concerned. We really need to get people vaccinated as quickly and as generally as we possibly can.
All right, here's our next question from a viewer. Take a look.
I'm a snowbird and spend my entire winter here in the valley. I am not a resident of California, however. Will this create any issues when I go to get my vaccine?
Thanks for that question. We have certainly received a lot of questions from snowbirds in the valley. Kim, your response, and are the rules for getting the vaccine different for people not just from other states, but also from other countries like Canada?
No, so we love our snowbirds, and we want to make sure that people that are spending a considerable amount of time here in Riverside County, whether they're in the valley or somewhere else in the county, are vaccinated and protected. So they would absolutely be able to get the vaccine.
And I'm also curious, Kim, I know the vaccine is free, but is it also free for non-Californians and non-citizens like Canadians?
Yes, it is free.
All right, here's the next question.
Hi, this is Lori from Indio. My question is it safe to get your vaccine from two different pharmaceutical manufacturers? For instance, you get one from, let's say, Pfizer, and then you get a second one from Moderna. Is that safe?
Great question, Lori. Tim, can people switch the type of vaccines they get?
Thanks, Lori. They're actually not making a recommendation to switch vaccine types during the middle of it. The studies were done with the same vaccine producing immunity, so Pfizer to Pfizer, Moderna to Moderna. Those two are the same type of formulation, being an mRNA vaccine. However, we do not want to switch manufacturers during the vaccinations.
All right. Anne in Palm Desert would like to know, if someone already had coronavirus, do they still need to get the vaccine? Dr. Williamson.
Yeah, that's a really great question. And there's a lot of nuances to that in terms of timing. Obviously, if someone is just recovering from an acute episode of COVID-19, I think it's probably not advisable for them to be vaccinated at that point, and may well be unnecessary as well. But the recommendations coming down from CDC and others is that we still do vaccinate people who have been COVID positive in the past, because we don't know what the immunity, how long that immunity lasts, either for the disease itself or for the vaccine. So in order to really maximally protect our population and try to get this pandemic under control, it is strongly recommended that even people that have already been diagnosed with COVID-19 should be vaccinated as well.
All right, here's a question we received from S. Wilder. What proof will a person get at the shot location that they received the vaccine? And what is the follow-up procedure to ensure a second shot is taken within the required time frame? A call, a text, or is the person on their own to get the second shot? Kim?
Thank you for that question. So when somebody comes through one of our mass vaccination clinics, they will receive an immunization card similar to what you've seen for childhood immunizations. On that card, it will indicate the vaccine information, which manufacturer they received, and what the date of their first shot was, and what the date that their second shot is due. So that will be given to each individual that comes through and gets vaccinated. On top of that, we will be sending out reminder texts or emails because people will be entered into the California Immunization Registry for this vaccine, just like they are for every other vaccine that is administered. So there will be a follow-up and reminder system in place.
All right, coming up, our local medical experts answer more of your questions about the vaccine. Can you still test positive for coronavirus after receiving the vaccine? Will the vaccine protect you against the mutated strain of the virus? And how does the Moderna vaccine compare with the Pfizer vaccine? Find out. Stay with us for this special edition of News Channel 3 at 6:30, Your Vaccine Questions Answered. Welcome back to this special edition of News Channel 3 at 6:30. Our local medical experts are here answering more of your questions about the vaccine, so let's get to the next one.
I have a two-part question. After I get vaccinated, will I test positive for coronavirus if I get tested? And two, can I still be a carrier after being vaccinated?
Thanks for that question. Dr. Williamson?
You would not test positive following vaccination just because of the vaccine. You would test positive if you had been exposed to coronavirus at some point along the way as well. So no, there would not be a reaction where you would show up positive after that fact. And as we mentioned earlier, we think that the vaccine does indeed reduce the likelihood that you can carry the virus and spread it to other people, but we don't believe that it eliminates that completely. And so it is still important that we use all of the other measures that we talk about routinely that we're doing with the face mask, with social distancing, hand washing, and so on, to be sure that we do not spread this to other people.
And along those lines, Dr. Williamson, we received this email from Brandon Brody in Palm Desert who wants to know, when will we begin to see the effects of the vaccine?
So we're already beginning to see some effects because we've been vaccinating the frontline healthcare workers. And so we're seeing less of our healthcare workers becoming ill and having to take off from work, which greatly impacts us when the current crisis really is in staffing. That's our biggest issue, is being able to staff the hospital appropriately. So critical that we do vaccinate all of our frontline healthcare workers first, and we are seeing an effect from that. When we'll see an effect in terms of actually curbing the number of cases that you see reported every day on the news is not until we really start to reach out into the general public, which hopefully, as we mentioned earlier, is going to begin as early as next week.
All right, a viewer emailed us this question. Will the vaccine protect against the mutated strain of the virus? Tim?
Thus far, they've already done some preliminary work with Pfizer, and they're showing that that is actually offering some protection against the new variant. I think Moderna is also in the process of testing their vaccine against the variant and showing some efficacy as well there. So currently, there's no claim to suggest that they're not going to work against the variants that are currently existing in the strains.
Here's another question for you, Tim, from a viewer. What happens to those unable to get the second shot within a prescribed time? Do they live with significantly reduced protection? Do they have to start the process over and get 3 vaccinations?
So that's a great question. We're running into that a lot for different reasons. And I think to enlighten on what Kim said earlier, we're not turning anybody away that's a traveler or out of area. But what we are making sure is that they're going to be around or have access to that second dose. We see roughly 55% or so protection from the first dose. So it is important that that second booster is really given, because that's what's getting us to the 95% mark. If they can't make that 3rd, 4th week dose where they come back at 21 days or 28 days, the recommendation is to get it as soon as possible thereafter.
All right, here's another question we received from a viewer named Shirley, who emailed us wanting to know, will we get the vaccine at drugstores like Rite Aid as we do with flu vaccines, or do we get it from a doctor's office? Kim?
Thank you for that question, Shirley. So right now, while we have limited supplies of vaccine is going out through our mass vaccination clinics and to physicians' office, community clinics, hospitals, so physicians' offices. Eventually, as we get more vaccine available to us as a county, we will be providing vaccine to these pharmacies. And as more vaccine is available nationally, some of those national chains will also get vaccine. So the goal is to eventually get vaccine in all of the traditional places where you're able to get vaccine. It will just take us a little while to get there based on the availability and supply of vaccine right now.
Another question for you, Kim, comes from Victoria Shatavi, who is a special education teacher at Indio High School. She would like to know, when will teachers receive the vaccine?
Thank you, Victoria, for that question. We all know teachers are so important to community and to our children, and teachers are actually slated to get vaccine as part of phase 1B in tier 1. That's where educators are going to be eligible for vaccine. So that could start as soon as next week.
Okay, moving on to the next question. Take a look.
Hi, I'd like to know, of the 2 vaccines available, which one is better to take, and which one did you as a medical professional choose to take? Or is it worthwhile waiting until the Johnson & Johnson one comes out?
Okay, I'll ask all 3 of you this. Dr. Williamson, let's start with you. Which version of the vaccine did you receive and why, and does it matter?
I received the Pfizer vaccine. The why is because that was the one that was available. At this point, we don't really have much choice in which vaccine, especially early on. There are some differences in terms of how you have to prepare the vaccine and store the vaccine, as we've all heard. So I won't say that Pfizer and Moderna are exactly the same in every respect, but in terms of the effectiveness and the safety of them, they are both extremely effective and extremely safe.
Tim, same question.
Yeah, I actually received the Pfizer vaccine as well, very much as Dr. Williamson expressed. During early allocations, we took the availability of the vaccine that we had. Also, those sites that were able to utilize and store with ultra-low freezer capability tended to get the Pfizer vaccine first before the Moderna. And just to mirror what Dr. Williamson said, they're pretty much neck and neck in similarity. The primary differences in the storage.
And Kim?
I actually have not been vaccinated yet because I am not in an eligible group. I'm not a direct healthcare provider, so I'm waiting for my turn.
Okay. I have heard from some healthcare workers I know that they had negative reactions with the second dose of the Pfizer vaccine. Have any of you heard that as well? And is there any reason why someone should choose one version of the vaccine over the other? Dr. Williamson, would you like to answer that?
Yeah, actually, it's true of both vaccines. There is an incidence up to about 5% or so of patients who do get a significant reaction after the second shot in particular. Some even get some response after the first shot, but it is very self-limiting. Typically, these symptoms last for 1 to at most 2 days and then resolve completely. And they are not an infection. They're just a reaction to the vaccine, and really an indication that basically the immune system is doing what we want it to do. It is responding to that vaccine as it would to the virus, and that's what builds our immunity.
Okay, thank you everyone. Coming up on this special edition of News Channel 3 at 6:30, I'll ask our medical experts when they expect life to get back to normal and hear their final thoughts on the vaccine. Stay with us. Welcome back again to this special edition of News Channel 3 at 6:30 with 3 of our Valley's top medical experts. All right, let's do a simple show of hands. Raise your hand if you think most people in the Valley will have received the vaccine by the start of this summer. None of you. So when do you think that will happen?
I think as we move through the summer, we will really see most people lining up. You're talking about a few 100,000 people in the Coachella Valley, and just trying to get through our 4,000 employees plus physicians and staff on top of that, around 5,500 people, has been a Herculean effort over the past 4 or 5 weeks to get this accomplished. So to get the entire population of the Coachella Valley, or even a substantial chunk of that population vaccinated, is something that is going to require an enormous amount of effort and planning and a scale that we're just not used to at this point.
All right, raise your hand if you think the vaccine is 100% safe and people should have zero concerns about receiving it. None of you again.
Well, I won't say 100%, but I raised my hand, a little bit, that it is extraordinarily safe and extraordinarily effective compared to any other vaccine we've seen, that for the most part, most of us accept as being an appropriate way of managing public health. So I would not be afraid of this vaccine. They really need to get vaccinated.
And finally, raise your hand if you think by this time next year, the virus will basically be eradicated here. None of you again. Wow. Okay, so this is going to be sticking around for a while, you think?
Okay. I think we're going to see it cycle through periodically, very much like the flu. The question is are we going to have to revaccinate to reboost against a new variant to continue our immunity, and what that duration is going to be? But we're going to see it cycle through as one of our common viruses.
Okay, now I'd like to hear final thoughts from each of you and what you would like people to know about the vaccine and its distribution. Starting with you, Kim.
Just would like to remind everybody this is a safe vaccine. We want people to get vaccinated. This will help us move to the other side of this pandemic. So please get vaccinated, wear your mask, wash your hands, and physically distance yourself from others so that we can come out stronger and healthier on the other side.
Dr. Williamson.
For the sake of your friends, your family, your community, it is critical that we all take this vaccine. We should not be reluctant to do so. And we have to continue on top of that, unfortunately, though, to use all the other public health measures, wearing your mask, washing your hands, and so on, until we indeed do get to the other side of this. But it's coming. We do have a light at the end of the tunnel.
And Tim.
If you have had COVID, you're not necessarily immune long term. So the recommendation is still continue to get your vaccine, because we want to make sure that we're really building up that immune response for the long haul. So there's some individuals that think, oh, I had the COVID, so I don't need the vaccine. And that's not true. You want to make sure you get vaccinated to boost that immunity and sustain it.
All right. Thank you, everyone, for answering all of these questions tonight. This was certainly informative. And thanks to you, our viewers, for sending them to us. Remember, you can continue sending your questions anytime to coronavirus@kesq.com. I'm Peter Dowd. Thanks so much for watching, everybody. We hope all of you stay safe. Have a great night.